Mandy, Miranda, good to see you all.
Morning.
We're just going to wait just a couple of minutes and see if any other hospitals are going to join us today. It could just be that we have a small group, but want to make sure before we dive in that we have everybody. Oh, there's Heather. Hi, Heather. Um, Heather's joined audio. Good morning, Heather.
Good morning. Sorry it took me a minute.
No worries.
I had a physician on my phone at the desk and I couldn't get away. So,
No worries. We appreciate you handling those kinds of things. Well, so far we have just the four of you. So represented, we have Jessica at Lakeside. Mandy's with us from Claremore, Indian. Miranda is with us from Great Plains in Elk City. And then Heather, thanks for joining us in your neck of the woods. So this is our fifth learning session, and really the main goal of our session today is we want to talk about kind of tying things up and getting ready for launch. We will, because we have several launch events in October, we do plan to not have a learning session in October, but pick it back up in November, just kind of following up with our post-launch updates then. So a couple of announcements before we get into the rest of the content. We have a webinar series going on right now. Evelyn has been hosting that, and it is called Nurturing Recovery, Substance Use Disorder, and Trauma-Informed Care. We do have two more sessions left of the four-part series. So if you haven't registered, you can see the link there. Our next one is going to be tomorrow, and then we have another one next Thursday as well. We do have our OPQIC quarterly meeting coming up next month. There's the registration link. We typically have those 4 times a year. They're from 5 to 7 p.m. via Zoom. And then if you haven't saved the date for the summit yet, it's going to be on November 19th in Oklahoma City. And we don't have registration open, but as soon as it is open, we will let you know. But just maybe mark that date on your calendar to save space. We're very excited about um, the summit. And then I know we've mentioned before, but just kind of continue to remind you that as we transition to the Oklahoma Hospital Association, we're having to change our Zoom links and meeting invitations. And so that will officially take place October 1st. So any events that we have scheduled from October 1st and beyond, we're going to be canceling those meetings with sending a new invite with a different link. So keep that in mind. We're going to cancel that October learning session and then send a new invite for learning sessions going forward in November. So if you see things getting canceled, don't worry. We're not necessarily canceling them, but we're just transforming them to a different calendar.
Denise, do you want to update about OPNF change?
Absolutely. Yes. So we're talking about the date change to our September. Yes. So for those of you who are planning to join our September meeting for OPNF, we will be changing that from the 12th to the 19th. So because of the Nurturing Recovery webinar series, we're changing that to September 19th. And I'll be changing that calendar invite later today as well. Thanks for that reminder, Evelyn. So just kind of a recap. So what we were hoping that you all would be able to accomplish in August. I'm not going to necessarily read through the checklist here, but really just kind of continuing to engage your champions, training your staff, preparing for launch, tracking the education of your staff and providers, and then beginning that launch planning, sending out email invites and things like that to your executive team. So just kind of a check-in. I know that we've been talking to you on our coaching calls, but wondering if anybody would want to share kind of your status for, are your boards ordered? Do you have them in? And how's staff training going, and any patient surveying if you've started? So Anybody wanting to jump out and share? Does anybody not have your boards ordered yet?
Ours are still ordered. We still don't have them in person.
Okay. But ordering, and I know maybe you guys are still in the process of finalizing your boards since you just got your approval.
We have ordered them and they are actually here. So we do have our boards.
Amazing. Okay.
We do have the survey ready to start next week. We're going to start handing them out next week. We just might need a little bit of help with walking through how to get them to you. Because we have
Okay.
designated to upload those.
Okay. Yeah, and I'll be happy at the end. We can kind of go over that. There's a QR code, but I'm happy to show that process. That might be helpful for others as well. So thanks for asking, Jessica. Anybody else starting patient surveying or planning to start patient surveying?
Hey, it's Miranda. We are planning on starting ours next week as well.
Okay.
So, and we have our boards ordered. We have just one in and that we're utilizing for just some staff training and things like that, but the rest should be in shortly.
Awesome. Well, thank you guys for sharing your updates. I know that you all are all well on track for getting prepared for launch and implementation, and we're super excited. So mainly what we want to kind of focus on today is a brief update on Atlas, and then we're going to go over that fourth quadrant of the board, so that fourth TeamBirth behavior, talking about the next huddle. And then we want to provide some time to talk about board, like necessarily like scenario-based training and how you would utilize the shared planning board within that training, a little practice session. So Katie, I'm going to pass it on to you.
Thank you. So everyone, thank you so much for completing your Atlas surveys. We are getting all those tabulated right now and all the presentations put together for you. So we will be presenting the results of those Atlas surveys at your coaching calls in September whenever we're scheduled to meet with you. Please feel free to invite anyone that you'd like to that meeting. The information is just really good for everyone to hear. So you can forward out your coaching call invite to whoever you like. And then we will make sure that we email you the presentation after the call. That way you're able to share it in staff meetings and that kind of thing. And then 6 months after you launch, we will redo the survey, and that's your progress survey, just to kind of see how things have changed on the floor, staff thoughts, that kind of thing. And then you guys will get the presentation for that one.
Great. Thanks, Katie. Looking forward to seeing those. There's a lot of good information on those, and it's nice to go over those with you all. So, and then Evelyn, are you ready to go over next huddle?
Yes, and I'll apologize up front. I'm kind of getting a little bit sick, so bear with me. My voice is a little off today, but hopefully, I know in past sessions we've kind of talked about the board and using the board, and we've talked about it a lot about using it, especially on admission huddles. And today we want to focus a little bit more on the next huddle, next assessment type of use for the board. And so thinking about during the labor, when things are happening, when would that next assessment huddle take place? So on the board itself, Denise can flip back to the previous one. You know, we have that section on the board where it says next assessment. We've talked a lot about the team, the preferences, and the plan, but we always want to keep the patient informed as to when are we going to group back together again and talk about what the plan is moving forward. And so that's where you're going to put that information. So for example, it could be, we're going to write on the board, it's going to happen at 11:30, maybe it's 9:30 in the morning, and doctor says, let's talk back about lunchtime when I come back to make rounds. So you're going to put that on the board. The patient then knows when to expect, or give them a time range, or it could be associated with a symptom. So for example, when you feel the urge to push. So on the next slide, you'll see kind of a full example here, excuse me, of where we put that next assessment. So you've got your team, your preferences, what she's doing. She wants to sleep, have an epidural, no visitors, let the water break on its own, plan for mom to nap between turns and monitor baby, labor progress, turn, Pitocin before breaking water. And then actually, I'm wondering if that should say epidural before breaking water, actually. And then the next assessment, as we talked about, would be when you feel the urge to push. Then we're all going to come back together and assess what the plan is for moving forward with labor. So let's move on forward. Hopefully, do you have any questions about that, guys? It's pretty cut and dry, I think. The main goal is just to help continually keeping the patient informed and in the loop, and remembering that the huddle is for her and not just for us or the provider, and that we want to give the patient the opportunity to share what her preferences are moving forward with the birth. So let's talk a little bit about discussion guides. Can anybody tell me if they have already started looking at discussion guides or using those for training? Anybody? Okay. Well, hopefully you have seen these in some of the materials that we've put out. But the discussion guides are there to help make a connection between the training plan and what's going to happen. And so we want to encourage you to identify main points or occurrences of friction, miscommunication, or confusion, to pull these out and utilize them. At minimally, just discussing key points on admission or with changes of plan and care. And so we'll kind of walk through what that looks like here. Let's go ahead and move on to the next slide. So here are the three main discussion guides that have been developed and tested, and they're used as a support. Remember, this is a support to the huddle. This is not to be used as the main points in the huddle. And the first one, the admission discussion guide, is kind of exactly what it says, to help educate the patient on when is the best time to admit. If they're in early labor, giving them options. Do you want to go home? Do you want to stay close to the hospital? Maybe go walk around the mall, but you live far away, so you don't want to go all the way home? Or would it be best if she stay in the hospital and be monitored? So very simple terms that these have been developed to make sure that they're in the terms that a patient can understand. It's using evidence to support it, but in terminology that the patient can understand. And these discussion guides are on the ARIA website. We also have them on our website as well. And so you can download those, make copies, use them during your training. Some of the hospitals have taken them and laminated them and put them like on a little ring and stuck them on their monitor right next to the bed, just so they're handy to pull out for throughout the stay. The labor support guide is exactly that. What can we do throughout the labor to provide support? So it's kind of hard to read, I'm sure, but what are your options? Moving, breathing, all the different things that can help move labor along, repositioning, applying, heat and cold therapy, massage, all those different things. And then obviously labor tools such as birthing balls. Again, this is sort of like preferences in a way, giving them options. So if you already are using a preference sheet, you may or may not need this, but it can give you, it says, what options can you try with yourself for yourself and what options can the team assist you with. So then again, moving on to more medical intervention, medications, epidurals, things like that, breaking water to move labor along. These are things we all know about, but our patients may not know. And so again, just a support or a guide to keep next to the bed. The last one is the assisted delivery discussion guide. So this is where, and we'll kind of role play this here in a minute, but this is going to be that tool that helps the patient understand when you're in a category 2 or category 3 tracing, things aren't looking good. What can we do minimally? And so we can, opt for trying to do vaginal delivery. Maybe we're going to have to use increased Pitocin, forceps, vacuum, what have you, or do we need to move to a C-section? Now, this is not for those emergent situations, but this is for those situations where we're just kind of unsure, or maybe they've been pushing for a long period, or maybe they're not dilating and it's taking forever. So consider this. Again, it's in language that the patient can understand. And if you go to the ARIA website, I believe it's in other languages as well, so that you can get translated versions. So let's move along. Oh, so these are just, again, some other ways that you can utilize the tools and kind of talk about facilitating in these different categories on the board. Now, remember, if you haven't started training, training is not a linear thing. It's not a one and done. Like, this is a time for you guys to practice over and over. You can take certain points, but we know that it's going to be hard to try and just implement everything all at once. So practice maybe doing a slow start and kind of practice with just doing huddles. And then maybe as you get really good at huddles, then you practice again at integrating the tools into the huddles. Obviously, with your huddles, you want to implement the boards, the shared planning boards. So try to work on those things. I know a lot of hospitals, that's kind of what they'll do, is they'll focus on the board and the huddles and making sure they're getting huddles happening with their patients and their providers. And then later on, maybe introducing the tools. Some just go gangbusters and do it all at one time. But this is a time for you to kind of, work on this over and over again. It's not just let's practice one time and then we're done and we're going to, move on. So consider that approach as you're thinking about your training. So let's talk about a situation where maybe we've been laboring, she was admitted, and now we're transitioning and we have a category 2 tracing. And so let's talk about some things that we're going to do. On our end, we're going to obviously turn off Pitocin if it's starting to look ugly and we want to call a huddle, right? This patient is 40 and 3 and she's got some variables, and so we're turning off the pit. And so what are some of the next steps that we're going to do? We're going to do in this scenario. Let's come off mute and kind of share how you would move forward with this huddle. What would you say? Come on. Nobody? I mean, I know you guys know this stuff. What are you gonna tell your patient? She's going, why are we turning off the Pitocin? What's happening here? Everybody's coming in the room.
So I would just tell her, explain to her that what a category 2 strip is, that we are turning off the Pitocin, that we are going to continue monitoring her baby, continue doing different position changes, and see if, labor progresses on its own, and if we can, have the vaginal delivery. I assume the doctor would, discuss that our goal is a healthy mom, healthy baby. And if the strip doesn't kind of straighten out, what our other options are.
Great. Thanks, Miranda. And so here's a time when you could potentially pull out this tool of the assisted delivery discussion guide to just say, here's where we're at now, but here are some things that we might have to consider moving forward. And we just want you to be aware of that. So good job. Okay, what about, let's see. Let's move on to the next one. We're going to kind of do one from the start. So Katie is going to fill in the gaps. And so let's talk about one where now we have maybe she has not progressed as well as we would like for her to. And so how are we going to, and this is a patient who does want to go naturally on her own. She has not wanted Pitocin, but now we've kind of got where she's stuck at a 6 and hasn't changed in several hours. And now her strip's starting to look, category 2, not so great. How are we gonna fill this board in? Let's get somebody else since Miranda branched out there first. Anybody else? Katie's gonna fill in the gaps for us. I guess you can fill in the team there, Katie, if you want. So we've got what were her preferences that I just read off? Jessica? Do you remember?
Yeah, going natural.
Okay. Anything else? So you're in the room, you're huddling with her, providers in the room. What are you guys talking about?
Probably the baby strip, that it was category 2, interventions that might be needed.
Now, are you going to pull out this tool at that time? Are you going to kind of talk first, or what are your thoughts on that?
Honestly, I would probably let the provider go through that, but I would also have the handouts there to answer questions, kind of troubleshoot and answer, explain things.
Mm-hmm. Okay. And so when would you, so now we're going to talk about, let's say the plan is, since she has not been on Pitocin and she didn't want to be on Pitocin, but we know that we're stuck at 6 and our options are we can break her water, We can add Pitocin. Those are some of the plan. She agrees to both things, but still wanting to not have any medication or epidural at this time. So what would you say would be the plan for the next assessment?
I would say it would depend on how baby is looking, like how the strep is going after any interventions, as long as she's making progress. So to recheck.
Yeah, I was going to say, go ahead.
Yeah, just to recheck within the hour.
Okay, so then on the next assessment, we would put, that we're going to do an exam in an hour. Make sure that she understands that, so she knows why we're doing that, to see if we're going to be moving forward with the current plan. And so just remember that we want to keep the patient in the loop at all times, and it not be like we're telling her this is what we're going to do, but asking and just, are you okay with this plan? Here's what we feel like should, happen next to move forward. How do you feel about that? Do you have any questions? And just giving her that autonomy and that respect to be able to trust you and be able to move forward with the delivery. So, and then I just wanted to mention with the tools, I know it seems kind of awkward sometimes, and we want to always turn to the provider. I went to a practice session that they did with the OSU residents, and it was really eye-opening to see kind of how the nurse had the tools there. And, Dr. Short, would you like to show the patient here about the delivery discussion guide and go over that with her, and just the nurse is helping guide the provider. Make sure your providers are involved in your training and have seen these tools and, agree to use them. We don't want to just spring it on them all of a sudden one day where they haven't been involved in this at all. So if you're going to be introducing the tools during your training, you need to make sure your providers have seen them as well and they understand what their use is. Now, there's explanation in the videos about this, but it's also helpful for them to see them, print some copies, hand them to them, let them look them over. Do they have any concerns about these? Okay. Any questions about the huddles, using the tools?
And I'll just add that the tools are based on ACOG and SMFM guidelines. So there really shouldn't be too much pushback, but it is helpful if they are very familiar with what is discussed. And it really is just, like Evelyn already mentioned, to help guide the discussion. It's not necessarily this is what we're going to do kind of a piece of paper, but it's just to help guide the discussion and the rationale for why they may be recommending some of the things they're recommending. So that's just one part of how we help to encourage equitable care, that all the patients are receiving the same information. It's very consistent in what they're receiving. And it's provided in patient-friendly language, so they might be easier to understand. So if you have some providers that kind of have a hard time bringing it down to that level, this could be a helpful way to share that as well.
Not only that too, but thank you, Denise. That was very good information. But also some people don't always hear everything that's being said. And so having it there in writing as you're talking to them, helping, and they're seeing it in their terms, they're better, they're soaking that in a little bit more, and they're able to ask questions about it without it just being kind of sitting there listening and and then after you leave the room they think about it for a while. Oh, I need to ask a question about this. So I think that's another reason why we want to have it in writing. And that's why we use that shared planning board as in writing, because we don't always hear everything that's being said.
Under the section that on the website that has our assisted discussion guides and that kind of thing, there's also a link on there to patient-friendly language for use on the shared planning board. I think as nurses, that's the hardest thing for us, to not write SVE, to not write AROM. Our patients don't know what that is, but that's what we're charting. And so to turn our mind back and forth. Also remember that this is the patient's board. So, tell dad, hey, dad, will you get up there and write this for me? Because then they're also going to write it in patient-friendly language. So they could get up there for you and write while you're having these discussions. All right, dad, I need you to write. We're going to check her again in an hour. I need you to write that we will break water if she doesn't change her cervix. And then let dad write that up there. Then they're also not having to answer the same questions for every family member that comes in after that check-in conversation. Because, they all come back in and they want to know what happened, and they can all look at the board and also be aware.
Thank you, Katie. Good point. Any other questions or comments about next assessment or discussion guides? Okay, I'll let Denise move on to launch.
Okay. And I'm just curious, for those of you that have, because scenario-based training is kind of that labor-intensive piece that you all try to accomplish before we launch with you all within the next couple months. So is anybody done scenario-based training? Was there anything during your training that kind of surprised you? Any areas of filling out the board that your staff had any questions about?
We haven't done any yet. We're working on getting them scheduled with our educator, Lindsay.
Gotcha.
We have done some. I think the biggest, and we have used those discussion guides as well. My phone just wouldn't come off mute, but and then there are some kind of scenarios that we printed from the website as well. I think the biggest obstacle is that not putting no AROM, letting water break on its own, or even like skin to skin, we use that, like it's but just utilizing that, placing baby on mom's chest after delivery. That's kind of doing our scenario based trainings. We've done a little bit, and that was kind of the biggest thing that we're just so used to using our language and our jargon, and so we're kind of having to dial that back. But other than that, I think the staff, again, they're like, I think we already do this, but I keep telling them that's what everybody says. So, but I think it's going well.
Yeah, I think it's good for them to actually, through the training, get the practice of filling out the 4 quadrants and kind of honing in. This is our whole goal of the program. And like you said, pointing out the things that, yes, we are patient friendly and we're trying to do patient driven, but putting it on a board just adds that piece of intentionality to it that really, I think, sometimes surprises staff on what a difference it makes. And making the communication clear and visible is a big piece.
The other one was the baby, kind of the plan for the baby. Because a lot of times we do continuous monitoring, but that is an option. Or, if the mom doesn't want internal monitors, my staff, they felt like they were like, we know what to put with mom, but baby, they kind of felt like they just didn't have, like a plan for the baby. So,
right.
Yeah. But again, I think that'll just come with kind of using it, and then the information that y'all had, kind of gave them some ideas with that.
And as Evelyn was going over this one, it kind of this labor support guide. I had never really looked at this way before until we were just reviewing it on this session. But in the middle, I know it's probably small for you to see on this screen, but it's broken out by mom, baby, and labor progress. So this could be a tool that you might use if your staff is having trouble figuring out what is a particular plan for baby, because you know what it is in your mind, but then what are you going to write on the board? I think Miranda is just what you were kind of describing. So there's some examples here of the team intervention, so monitoring intervention, and well, the team is over on the right, and then what, the mom can do for herself. So these are more like, these are things you're doing, and then in the right column, these are things that we're doing with you. So it's more medication and monitoring is the plans and the interventions on that right column. So that might help to kind of give your staff some ideas on what they might include in the plan section. I'm just looking at that support guide.
Thank you.
Then, like I said, our session today is kind of tying up those loose ends, trying to help make sure that you all are ready to launch. I know that we do have on our calendar, some of you are already scheduled. So this is when it gets real and the rubber hits the road. We're on our way. So just kind of, again, looking at your launch and going backwards, the main things that you want to have accomplished would be your scenario-based training. It's optimal if that's done within the 2 to 3 weeks prior to launch, so that whenever you do fully implement, that it's kind of fresh on staff's mind, that it hasn't been too long of a gap in between launch and planning. So one thing we want to make sure is this is what we have on our calendar, and we want to just double check and verify that this is what you have on your calendar. So if you see something, if you see a date that and time that you think is incorrect, please speak up and let us know. And we know that some of you are going to be launching the first week of October. And so we are kind of spread out between October and November. Some are having to wait until January because of circumstances within their facility. So we want to make sure our main goal is that launch is going to be successful for your team. So we are flexible and can work around your needs. Anybody have any things that you've, I know that we saw a t-shirt order come through from Weatherford. A few other of you had said you've received your boards and those are ready to be hung up. Anything else you all have done in preparation for launch, or do you have questions about getting ready for launch?
I know that we sent our preference lists to marketing and got that approved, and then to the print shop. So those are printed and ready. We gave the one pager to the physician's offices upstairs to be putting in the prenatal packets. And the t-shirt design has been done. I think it's just waiting to go through marketing as well.
Awesome. Is it starting to feel real? Like, okay, we've been thinking about this since February. It seems like it's been a long time, but now we're ready to go. Is anybody nervous or worried about something? Is there anything that we can help you maybe take some worry off your shoulder about a particular thing? Okay. Well, we can talk about it in our coaching calls this month if you do have that thing, but just want to emphasize again, we don't want this to be a stressful event for you. We know that, you have things that you have to get done, and sometimes that just naturally causes some stress, but we don't want you to feel overwhelmed or have any great anxiety. If there's anything that we can do to help you with this, please let us know. But really, again, that main intent of the launch is just kind of to mark that moment in time, like from this day forward, we're going through and we're implementing TeamBirth. We know you're not going to probably have 100% of your staff trained. We know your staff are still going to, some of them are still going to have some kind of a question on what even is this? And those kinds of things will be working out. We'll still have coaching calls within the next year after your launch, so we can continue to help you work through those kinds of things that come up. But we want this to be a time of excitement, and then just kind of solidify your facility's commitment to, okay, we are doing this and we're going to start today. So there is a checklist of things that you want to accomplish this month and before launch. Some of you have already done these things, but just we'll send this to you again in an email. But if you haven't done any small scale testing with some of your champions and maybe your provider champion, you might try that now. Like go ahead and get one of your new boards out and take just one patient and be like, okay, we're just going to practice this and see what happens. There may be some things that come up that you're able to then kind of tweak before you launch, with the entire floor with all of your patients. So consider doing some small scale testing if you haven't done that already. Again, emphasizing making sure your staff have watched the videos and have had the opportunity to go through some scenarios prior to launch. And then a lot of this is just kind of launch planning suggestions. Again, we are not going to have an October learning session. You will see that get canceled from the calendar, but our next learning session will be on Wednesday, November 6th, again from 9 to 10:30. We will be sending out a new calendar invite for that session with a different link, so keep your eye out for that. We do have our recordings and resources, remember, on the website. So the recording of this session will be posted on the Cohort 5 page. That password for that page, again, is TeamBirth, all lowercase, TeamBirth 5, all lowercase letters. And then you had asked if I would go to the patient surveying. So I'm going to get to that real quick. So on our website, on the TeamBirth page, in that green section where you can find most of the resources, including the discussion guides, and those are located right here under the implementation resources. And then if you look under the patient resources things, we have a QR code. So this QR code, you can scan that and it will go to the REDCap form where you would input the information for the survey. So you might, if you're going to be using a phone or a device like that to input the surveys, you can have that QR code posted somewhere, or you can just bookmark this link, which is here. And so basically what you're going to do is whenever you have a patient survey, you're going to find your hospital from the drop-down menu. And then note that we say that this date is used to determine the month of delivery. We don't necessarily need the exact date of the survey. So we compile them into months. So if you're entering a survey for, the month, like let's say I'm putting in a survey from September and today is September 4th, then you can just leave today's date in. You don't necessarily have to put the exact date of when you received the survey, but you do want to make sure that it's the month that you collected the survey in. And then you just go through and we'll click whatever your patient indicated on their actual paper form. So this is the first 7 questions where we're assessing autonomy. And then we have the 5 questions where we're assessing their trust. So that's the front side of the survey. And then on the back, we have their labor and postpartum huddle participation, their demographic questions, and then this is where you can input their patient comments. So that's probably the most time consuming part of it would be typing out their comment, specifically if they have a longer one, but the longer comments are better. So we hope that you find it's worth your time to type it all in there. And we do recommend that you type it just as they had written it. So don't feel the need to correct any grammar or spelling or anything like that. Just go ahead and put it in just as they did, and then you'll click submit. And that's the process. So we collect these in our REDCap database. And then once we have about 30 surveys collected from your facility, we'll be able to provide you with kind of an aggregate report to let you know how many surveys we received, and then displaying how your patients answered to the question. So did that answer your question, Jessica, about?
Yes, that makes it very easy.
Okay. It takes about, a minute or two, depending on how long the comment is, to enter each one. So if you want to save them, I know that some facilities that receive larger numbers of surveys, Like Trisha said, whenever she was implementing, she said she would set aside an hour every Friday morning and say that, okay, all the surveys that I've collected this week, I'm going to put them in now. So she would just kind of put them in as batches. And that might be a little time saving. And then you can also, delegate this responsibility to other people on your team. So if you ever have any questions about how many surveys you think you've entered, just let us know. We can look up the number if you're concerned that maybe they aren't getting entered. So any other questions before we adjourn today? We're excited that you guys are getting to this point. We know there's been a lot of preparation, and we know that the first few months of implementation are probably going to be the roughest. But after that, we promise it's worth it. So just kind of keep that in mind that it is work. We recognize it's work. We recognize that you have a lot of you're going to have a lot of stamina and energy going in and encouraging everybody to implement TeamBirth to its fidelity. But in the end, the reaping is worth the reward. So
I think just making sure as you're training, as you're talking about this, that you incorporate it into your culture and that you let everyone know this is what our culture is. This is not going away. This is here to stay. This is how we should treat all of our patients with dignity and respect and allowing them to have equitable care. And so I think if you go at it from that standpoint of this is just going to be our culture moving forward, then and continuing to monitor that and to bring it up as you are seeing it in actual practice and giving people praise for doing a good job. I think it'll move forward very, very easily.
well, if you all don't have any more comments or questions, then we welcome you to go on and carry on the rest of your day. Thanks so much for attending. You know where to find us. We're here.